I always say we couldn't do our work without our nurses and our team members, and our nurses are key to what we do. And we are very lucky to have outstanding nurse practitioners such as Samantha DePadova, who is one of the nurse practitioners in leukemia, actually responsible of the inpatient unit of the leukemia program.
Blinatumomab is a T-cell immunotherapy that was FDA approved in December 2014 to treat patients with relapsed or refractory acute lymphoblastic leukemia. We identified our first patient in December 2014 that would benefit from the use of this drug. So the Theurer Cancer Center was one of the first institutions to utilize blinatumomab outside the clinical trial setting. The processes that we had put in place with the first patient proved to be successful with our subsequent patients. I started to get phone calls from providers at other institutions all around the country who were also utilizing this drug for advice in regard to logistics and protocol implementation, because they had heard that we were successful in using the drug. So we really became a resource for other institutions who wanted to use this drug. So that's when I had decided that it may be a good idea to write this article to more widely share our experiences with the leukemia community to help improve outcomes for patients with relapsed or refractory acute lymphoblastic leukemia who were requiring blinatumomab as part of their therapy. People who have read the article had some follow-up questions, and I was able to respond back to them. I did have a phone conversation with one person and had emailed back and forth to help them answer their questions. The Oncology Nursing Society is a national organization that promotes excellence in oncology nursing and quality cancer care. In 2017, the Oncology Nursing Society awarded 6 publishing awards, one of which I was honored to receive for this article, along with my co-authors, Christina Howlett and Kimberly Rivera.
As the hematologic malignancies clinical pharmacist, I work closely with Samantha and the rest of the team to introduce new therapies at Theurer Cancer Center and really integrate the different order sets, medication guidelines, and formulary process that we have here. So once this drug received FDA approval, I worked closely with the team to develop those specific protocols in order to standardize our therapy. Receiving recognition for our review on the implementation strategy of blinatumomab is very rewarding and really highlights our dedication to both patient safety as well as excellence in patient care at Theurer Cancer Center.
The collaboration that we discussed in this article talks about a multidisciplinary approach, including nursing, nurse practitioners, physicians, pharmacy, our social work team, our case managers, all coming together to develop a safe and successful approach to administering this complex treatment for these patients. And this really embodies how we care for patients day to day at the Theurer Cancer Center. We all come together to provide the highest level quality care that we can for patients every day.
They presented their experience, and it was very beneficial for ONS that gave them the award, and we're very proud of their achievement. They represent the ultimate example of what our nurse practitioners and pharmacists are.